welcome to Respiratory HQ's Journey to Success podcast, the podcast specifically for RT students because you all are the future of the respiratory therapy profession, and not everything you need for success can be found in your textbooks. I'm Tanya Peel. I'm so excited to be here to give you a little guidance and insight, a few tips, maybe a few tricks to help you be successful on your journey through respiratory therapy school. Let's get started. Welcome back, everyone. If you are just joining us, last week we started a series of podcasts that dealt with the interview process, specifically the questions you as a new grad should be asking the hospitals upon interviewing to make sure that they are a good fit for you, because you want to go to work in a department where you are happy to show up and do your job, a place where you feel supported, a place where you feel appreciated, where you feel valued, and where you feel like you're an integral part of the team. So last week we started that podcast and we talked about how you pay attention during the interview to the overall impression you receive from the department director or manager, because first impressions count. Then we went on discussing questions that you do not want to ask during an interview. You always want to start out on the right foot, and so there are some questions that you should not lead with. And then we ended last week's episode talking about how to ask questions to see if the department had an adequate support system for therapists going out to take care of their patients. And basically, we phrased it as you want to know if you're being thrown to the wolves. In this week's podcast, we are going to talk about questions that you can ask to see if the department is invested in your growth. And when I say growth here, what I mean is growth in your skills, growth in your education, and growth in your leadership. Because you guys that are just graduating right now, you are the future of the respiratory care profession, and it's so important to get tied into a community, to a hospital, to a department that is invested in your growth in these three areas. So let's start with the first area. Okay, this is going to be a question that you can ask to see if the department is interested and invested in you growing your skill set. Because when we're in school, we spend the 2, 3, 4 years, however long you're in respiratory school, teaching you foundational principles, teaching you basic respiratory care, basic fundamentals of mechanical ventilation, so that when you graduate and get a job, you can use your basic knowledge base and grow in your skill and education. All right, so here's the question you want to ask. You want to ask if there will be opportunities to explore different teams within the department, because a lot of larger facility work on a team model. There may be a trauma team, there may be a cardiovascular ICU team, there may be a general medical surgical team. And one of the things you don't want to do right out of school is get stuck in one position, unless that's really what you want to do because you've already found your passion. But you might want to be able to explore different dynamics and different patient populations. So ask the question to see if you can be exposed to every aspect of patient care that the respiratory therapist in that department perform, because in taking care of different patient populations, you are going to grow different skill set and gain extra knowledge. Other questions you might want to ask about has to do with their interest in growing your education. So you can start out really easy with this. Ask them questions about continuing education opportunities. Some departments have multiple opportunities to gain CEUs, and you're going to need CEUs for your credentials, to maintain your credentials, and probably your state licensure. So it's really easy to get these things. If you go to conferences, you can find them online, but it's also nice if a department provides these for respiratory therapists in-house for free. So ask about CEUs. The second thing you can ask about is tuition reimbursement, because hopefully, especially if you're coming out of an associate degree program, oh gosh, there's so much in our field that we need to learn that it cannot be all contained in an associate degree program. So if you have an associate degree, hopefully you're looking to transition that into a bachelor's degree, at least, if not a master's degree. And so a lot of hospitals have tuition reimbursement programs. So inquire about that. Now, usually there's some type of contract that you sign that they'll pay you after the semester, or they want a guarantee that you will work for them for a standard amount of time. But ask about that opportunity. The third thing you can ask about to evaluate education, and if they value education, would be if they have any type of reimbursement system for specialty credentials. So let's say that you are really interested in diagnostics and you want to gain your CPFT or RPFT credentials. Well, some departments will pay for that test. Some departments might pay for a formal review for that specialty credentials, and some departments may give you a day off with pay to go take that test. So that might be a nice perk to ask about if they have some type of incentive for specialty credentials. And another question you might want to ask is if the department has a professional development program or a career ladder process. And what this is a really formal process that monitors the progression of a therapist from an entry level to a higher level of therapist that maybe takes on different skills, different responsibility, and ultimately a different level of leadership. Now, these career ladders are typically voluntary. You don't have to do that. But in participating in them, it provides career opportunities for the respiratory therapist who wants to advance their clinical knowledge and skill. It allows you sometimes an increased opportunity to work more autonomously and with more accountability in that direct patient care role. And in doing so, people have a pride in what they are achieving, and that typically leads to retention of respiratory therapists because it increases job satisfaction, and it allows somebody to know that they have opportunities for expanding roles. And the whole end result of these professional development programs or career ladders is ultimately to improve the quality of patient care and organizational outcomes. So asking about this in an interview, if it hasn't already been mentioned through the interview process, is really critical, because as you come out of school, you want to be able to just grow as much as possible as a respiratory therapist. And a department that has professional development programs or career ladder programs is really interested and invested in growing their respiratory therapists. So to summarize today's short and sweet podcast, we talked about questions you can ask to see if a department values your growth. Growth in your skill set by asking about working with different teams within the department. If they value your education, so talking about continuing education opportunities and specialty credentials and tuition reimbursement. And then finally, asking about career ladders or professional development programs which will help you increase your opportunities of forward movement within the organization and allow you to grow in leadership skills, which will ultimately transition into higher patient outcomes. So join me next week, and we're going to talk about the culture within the department and questions you can ask to figure out Well, really, if the therapists like working where they work, do they enjoy working with each other to work as a team, or is there a lot of infighting and gossip and just unpleasant negative conditions within a department? So I'm going to give you questions you can ask to ascertain that, as well as questions that you can ask to see about leadership involvement in that culture. So I'm really excited to be able to come back next week and us talk about that. Until then, I want you to study hard, keep thinking about that interview process, and keep pushing forward, because those of you that are going to graduate soon, the light is at the end of the tunnel. See you soon.